Good morning, Year 12. This is video for LO17, looking at how the biological approach treats OCD. So LO15 and LO16, we're looking at how the biological approach explains OCD. So where does OCD come from? And we've looked at genetics as one of those biological explanations, and then we looked at neural as the second biological explanation. Within the neural explanations of OCD, there were two parts. Remember, the word neural just means anything to do with the brain. So we had brain chemicals being one part, and we had brain structures being another part. So in terms of the brain structures, just a little quick recap for you. You had the lateral frontal lobes, these parts of the brain which are responsible for making logical decisions. And if there's any abnormal functioning in that part of the brain, that could lead to some irrational thinking. Then we also have the hippocampal gyrus, which is another part of the brain which is responsible for helping us deal with unpleasant emotions. So anytime you feel something that's not quite nice, the hippocampal gyrus helps us to process that. Again, if there is any abnormal functioning within that hippocampal gyrus, then what might happen in a sufferer of OCD is they can't alleviate that negative emotion, the anxiety and the stress that they feel because of those irrational thoughts. That leads them to have to resort to those compulsive behaviours, which is the only way they've got to alleviate that unpleasant emotion. Whereas in normal people who don't have OCD, the hippocampal gyrus would help process that for them. The second neural explanation we looked at was the role of the brain chemical serotonin. Remember, serotonin is a neurotransmitter. The word neurotransmitter is just a chemical messenger in the brain. And it sends messages that helps your brain regulate your mood and keep your mood at a stable level. If you remember in the last video, I said that we all have a relatively, if you're psychologically healthy, you will have a relatively stable mood. That's not to say you won't have ups and downs. Sometimes you'll feel great. Sometimes you'll feel a bit sad and a bit fed up. But relatively, most of us have a stable mood, and it's serotonin which does that. If your serotonin levels are accurate, and either they are too high or too low, then your mood can be affected. Now, scientists feel that one of the roles of serotonin could play a part in OCD, and they think that OCD sufferers have too little serotonin. Now, what that means is their mood, they can't regulate their own mood because they haven't got the right amount of serotonin. So that brings me nicely into LO17, which is looking at how can we treat that then? If we think that one of the reasons people get OCD is because their levels of serotonin are too low, then what we would need to do is give them a drug which would increase the availability of that neurotransmitter. And that essentially is the drug therapy that is used to treat OCD. We give our clients, or our patients in this sense, we give our patients drugs which aim to increase the levels of serotonin and improve the availability of serotonin in the brain. Okay, so I've got my AO1 slide in front of me. This video might be a little bit difficult because it sort of relies on the diagram. In fact, I might get the whiteboard. Ava? We'll see how we go. If I need to get the whiteboard, I'll go and get the whiteboard and come back. Right, okay. So the type of drug that we use to increase the availability of serotonin are called SSRIs. Now that stands for selective serotonin reuptake inhibitors. Okay, don't worry about trying to remember the full name of the drug, but if you just remember at the very basic level that SSRIs are a drug that we can give patients, and they work in the brain and they increase the level of serotonin. Serotonin is a brain chemical, and we think that people with OCD have too little serotonin, so we can give them SSRIs which improve the levels of serotonin and alleviate some of their symptoms. Alleviate's a nice piece of vocabulary if you want to put it in your vocab books, please. It's tier 2. You can use the word alleviate in lots of different subjects, and it just basically means to remove. So that will get you marks in the exam. Simply being able to say that will get you marks. However, for those of us who are going for those top grades and those really detailed answers, you'll need to be able to explain how these drugs work in the brain. Now, for my GCSE students, you're going to get this because we absolutely hammered synaptic transmission when we did biopsychology, and Nora, she's heard me. If I can get me some pens. She's heard me and got me my board. Right, so when we did GCSE psychology, for those of us who did, and there's quite a few of us who did, we did synaptic transmission, which is talking about how do the brain cells communicate with each other and get the chemicals from one brain cell to the next. And for those of us who didn't do GCSE psychology, this might be quite new to you. Please don't worry. Synaptic transmission comes up again when we do biopsychology, and we'll do that back in school together. And even if you don't quite understand this now through this video, hopefully when we come back to do it, it'll all sort of make sense. So at a very basic level, I want you to know that SSRIs improve or increase the levels of serotonin in the brain. To pick it up a little bit more detailed, you need to be able to explain how they work. Right. So, recap for my GCSE students and brand new for those of us who haven't done this before. These are two brain cells or two neurons in the brain. We call this the presynaptic neuron, and we call this the postsynaptic neuron. This thing here, this gap here between the presynaptic neuron and the postsynaptic neuron is called the synapse. That's why we call it the presynaptic, and the postsynaptic is the synapse. Now the chemicals, the neurotransmitters that we want to use, so the serotonin, it lives in the brain cell in little fluid-filled sacs called vesicles. So each one of these circles is a fluid-filled sac called vesicles, and each of these dots are the neurotransmitter, the serotonin. Now, while the neurotransmitter is in the sac, it can't do anything. It's completely not. It's not active at all. However, what happens is the vesicles will travel down the neuron, and when they get to the end of the neuron here, they will fuse with the membrane of the neuron. Right? They will just join it. And that will allow the neurotransmitters to be released into the synapse. Once the neurotransmitter is released into the synapse, it floats across to the postsynaptic neuron. And here we have little things on the membrane of the postsynaptic neuron, which are called receptor sites. And their job is essentially to pick up the neurotransmitter. Once they've picked up the neurotransmitter, it enters the postsynaptic neuron, and the whole thing will start again. Now, any unused serotonin like this bit here can't just stay in the synapse, because it will keep activating the receptor site on the postsynaptic neuron, and that wouldn't be okay either. So it can't stay there. So it has to be removed, and the way we remove it is through a process called reuptake. Okay. So what happens is these serotonin particles, these neurotransmitter particles, are taken back into the presynaptic neuron. They are put back into a little vesicle, and they are stored there ready to be used again, and that's called reuptake. Okay? Now, how these drugs work is they block the reuptake of the serotonin. They stop the unused serotonin from the synapse being absorbed back into the presynaptic membrane, so that it remains in the synapse. So if the serotonin stays in the synapse for longer, there's more of it available. Okay, so remember, if someone who's got OCD, they haven't got a lot of this neurotransmitter. So sometimes it could be getting taken back up into the neuron before it's had a chance to travel over and be grabbed by the receptor sites on the postsynaptic neuron. So what these drugs do is they stop it from being reabsorbed, or they stop the process of reuptake, and they keep the neurotransmitter, the serotonin, in the synapse to give it more of a chance of travelling across that synapse, being picked up by the receptor sites and activating the postsynaptic neuron. You might need to watch this video a couple of times. I'm going to quickly run through that whole process again, just for those of us who've not done it before. So understanding how these drugs work will get you more marks. Remember, they are called serotonin reuptake inhibitors, SSRIs, selective serotonin reuptake inhibitors. If you inhibit something, you stop it. So these drugs stop the reuptake of serotonin. To go through it all again very, very quickly with you, you've got two brain cells here, neuron 1, neuron 2. The gap between the brain cells don't touch, there's a gap between each of them. That is called the synapse. We call this one the presynaptic neuron because it comes before the synapse, and we call this one the postsynaptic neuron because it comes after the synapse. The neurotransmitters live in vesicles. These are fluid-filled sacs, and they can't activate while they're in those sacs. However, what happens is these vesicles travel down the neuron, and when they reach the end and they get to the membrane, they fuse with the membrane of the presynaptic neuron, allowing the vesicle to release the neurotransmitter content into the synapse, at which point they will travel along to the postsynaptic neuron, and there are receptor sites on the membrane of the postsynaptic neuron which are able to pick up that neurotransmitter. Any unused serotonin is automatically removed from the synapse to stop it from overactivating the next neuron. And we do that through a process of reuptake. So it's where it is repackaged back into a vesicle in the presynaptic neuron, ready to be used again. In a sufferer of OCD, that happens in all of us, by the way. That's a normal, healthy brain process. However, in a sufferer of OCD, if their serotonin levels are too little or too low, it's getting reabsorbed too quickly, and the serotonin doesn't have the chance of crossing over to the postsynaptic membrane and activating that next neuron. Okay, so what these drugs do is they bind to the site where the reuptake would happen, and they stop the serotonin being taken back up into the presynaptic neuron, which means it's got more of a chance to stay in the synapse and more of a chance to travel over to the postsynaptic neuron and activate the next neuron. That is all written really clearly on that slide, and there's a diagram. If you have got that, you should have this printed out. I would very much like it if you would cut this diagram out, stick it in your book and annotate it, the process of that all the way round. To start with the vesicle, travelling down. There is some annotation already on it for you, but you add in all that detail from my explanation. A couple of bits of other detail that you could add in. A typical treatment program will consist of a patient taking a tablet or sometimes liquid, 20 milligrams of this drug a day, and it could take up to 3 to 4 months of them taking this drug each day in order for them to take effect. Okay, thank you. Hope that makes sense. If anyone's got any questions, do not hesitate to message me and share my homework.